The painkiller you trust daily might be quietly damaging your stomach. Hello, I'm Annabelle, your health and wellness advisor. Today I will show you how ibuprofen can weaken your stomach lining and how to use it safely. Many people take ibuprofen almost casually. Headache, body pain, menstrual cramps, after football or gym soreness, just swallow one tablet and move on. Because it works fast, most people assume it's completely harmless, especially since it's sold without prescription in many pharmacies. But what many don't realize is this: frequent or improper use of ibuprofen can gradually weaken the stomach's protective lining. Not immediately, not dramatically, but slowly. And that's where the real risk lies. What exactly ibuprofen does inside the body? Ibuprofen belongs to a group of medicines called NSAIDs, non-steroidal anti-inflammatory drugs. Its job is simple: reduce pain, fever, and inflammation. To do this, the drug blocks chemicals called prostaglandins. These chemicals cause pain and swelling, so blocking them makes you feel better. But here's the hidden part: the same prostaglandins also protect your stomach. They produce protective mucus, maintain blood flow to stomach tissues, help repair minor stomach damage, control stomach acid impact. So when ibuprofen blocks them, pain reduces, but protection also reduces. How the stomach lining gets weakened. Your stomach produces strong acid, strong enough to digest food. Normally, a mucus barrier protects the stomach wall from being digested by its own acid. Ibuprofen reduces that protection. Gradually, this can cause irritation, burning sensation, inflammation, small sores, ulcers, internal bleeding in severe cases, and it usually starts silently, no major symptoms at first. Just mild discomfort people ignore. Early warning signs most people miss. Watch out for these subtle signs: burning pain in upper abdomen, nausea after taking pain relievers, bloating, frequent indigestion, feeling full quickly, dark stool, late-stage warning, vomiting blood, medical emergency. Many people treat these with more painkillers, making it worse. Who is at higher risk? Some people's stomachs tolerate ibuprofen less than others. Higher risk groups include people above 40 years, those who take it on empty stomach, frequent users, daily or weekly use, alcohol drinkers, smokers, people with ulcer history, those combining it with other painkillers, long-term use for chronic pain. For them, damage can happen much faster. The most dangerous habit: empty stomach use. This is extremely common. Someone wakes up with headache and immediately swallows ibuprofen. But without food, there is no buffer between acid, drug, and stomach wall. This significantly increases irritation. Over time, repeated exposure wears down the lining. How to use ibuprofen safely? You don't need to fear it, you just need to use it correctly. 1. Always take after food. Even small food helps create protection. 2. Use the lowest effective dose. Don't take 2 tablets if one works. 3. Avoid daily habit. Use painkillers should not become routine supplements. 4. Don't combine with alcohol. Alcohol's NSAIDs greatly increases bleeding risk. 5. Don't mix multiple painkillers unless prescribed by a doctor. 6. Limit duration. If pain lasts more than 3 to 5 days, treat the cause, not just symptoms. Safer alternatives for frequent pain. If you regularly need pain relief, instead of continuous use, consider hydration, stretching for muscle pain, proper sleep, treating underlying infection, medical checkup for recurring pain. Frequent pain is usually a signal, not the real problem. When to seek medical help immediately. Stop taking the drug and see a doctor if you notice black stool, vomiting, blood, severe stomach pain, dizziness after taking pain relievers, unexplained weakness. These may indicate stomach bleeding. Final thoughts. Ibuprofen is effective and useful, but like many helpful medicines, its safety depends on how it's used. The danger isn't a single tablet. The danger is habitual misuse without awareness. Understanding how it affects your stomach helps you benefit from it without harming your body in the long run.